This is first line treatment. When you click on it, what is on it? It gives you the specific first line treatment: pediatric, adolescent, geriatric, maternity. At least you know 1, 2, 3, 4 diagnoses. That's plenty. For each of them, that makes 12, right? That's 12 different diagnoses for different comorbid conditions. Okay, we're gonna move back now and go to the next content. The next content says study plan. We know what that looks like. This one says print LMR. It says print. It says for you to print it. Why is it LMR? Because NMS will be in your exam, extrapyramidal side effects will be in your exam, tardive dyskinesia, and so on and so forth. ODD, what does it really mean? Lewy body dementia, visual hallucinations, major depressive disorder, depressed mood, anhedonia, sleep disturbance, fatigue, suicidal ideation, major neurocork disorder, sleep disorder, nightmare, vivid recall of dreams, sleep terror involves intense crying, fear of usually no memory afterwards, and so on and so forth. So now, on the bottom, there is key difference between behavioral and mood disorders for pediatrics: defiant conduct, antisocial, intermittent, reactive attachment, adjustment disorder. All of these disorders will be on the exam period. All of them will be on your exam. No matter what version you get, it's going to be there. What do we need to look at? We need to look at what exactly do we typically see? What are the things? Core features. ODD, they are defiant. ODD, they are deaf. Oppositional defiant. Defiant, deaf. They can be vindictive. Conduct disorder, violation of rules, aggression, cruelty. Antisocial, personality disorder, disregard for others, rights and laws. Intermittent explosive disorder, recurrent explosive impulsive aggression, reactive attachment, poor attachment due to neglect or abuse. Adjustment disorder, emotional behavioral or behavioral reaction to a stressor. And then we have the bottom here talks about, must know for exam. I have the same thing here: conduct before age 15, more than 3 months of aggressive outbursts, history of neglect, abuse, or before age 5. And these are kind of some ways for us to remember them. Then on the bottom, we have Parkinsonism, akathisia, tardive dyskinesia, neuroleptic malignant syndrome, and each of the concepts. To remember them, you have to know all of this. With Parkinsonism, tremor, rigidity, bradykinesia, so shuffling gaits, masked faces. Akathisia, inner restlessness, pace, inability to sit still. Tardive dyskinesia, involuntary repetitive movement, smacking of the tongue. And then NMS, fever, rigidity, altered mental status, and autonomic instability. Then we have our favorite lithium here. Anything and everything about lithium is possible. TSH, electrolytes, pregnancy tests. Valproic, we're going to be checking valproic level. LFT, CBC, this will be on your exam. Your labs will be tested. These ones are they're interested in this one specifically. Carbamazepine level is 4 to 12 mics per ml. We have to monitor the drug therapeutic level. CBC with differential must be obtained because they have risk for granulocytosis, aplastic anemia. LFTs risk for hepatotoxicity. Electrolytes can cause hyponatremia. Genetic testing, HLA-B1502 Asians are the ones that we have to test that on. Lamotrigine, there's no routine labs. We still have to monitor for rash though, because it can cause Stevens-Johnson's rash too on general population. Clozapine, we monitor CBC with ANC level. Olanzapine, obesity, so we're checking for fasting glucose, hemoglobin A1C, lipid panel, weight or BMI. There's risk for insulin resistance, diabetes, risk for dyslipidemia. Common cause of weight gain is olanzapine. Olanzapine, obesity. Quetiapine, we call it cataracts. We also have to monitor for yearly eye exam, but it's also a second gen, so of course, metabolic syndrome is one of the side effects. Risk of diabetes and metabolic syndrome, dyslipidemia risk. So we must obtain lipid panel. Risperidone, hyperprolactinemia is a problem. One of our second gen that have APS effect. It can cause hyperprolactinemia, amenorrhea, gynecomastia. Stimulants, of course, stimulating the heart can raise the blood pressure, can raise the heart rate. Risk of hypertension and tachycardia. SSRI, SNRI, sodium in elderly. Hyponatremia is very common with SSRI in the elderly. So we need to make sure we're checking for sodium level. Hepatic metabolism is also common. Then suicidal ideation. monitoring for SSRI or SSNRI for those patients on it. MAOI, we have to monitor blood pressure, dietary review, timing, containing food. So we raise them. We put them at risk for what? Hypertensive crisis. Risk of hypertensive crisis, prevent hypertensive emergencies. Okay. So that is pretty much that for this content. I'm now going to move to another content. This one says Pillow Package 2.0. By the time you start looking at everything, you will see that things are actually repetitive. Okay, with Pillow Pack, we see phase 1 foundations. We have complete CBC, complete metabolic panel, liver function test, antidepressant, antipsychotics, mood stabilizers, anxiolytics, stimulants. So this is kind of nice, but it was a little bit bulky. So I kind of highlighted the areas that you kind of need to focus on. But it doesn't mean that the other areas are not important though. Repression, regression, displacement, frequently tested. I put those in highlights. Okay, so that's your Pillow package right there. Then we have neurotransmitters, the basic parts. You got to have your neurotransmitters down too. Know the very basics, read it every day. Know the 111 definition: acetylcholine, memory; dopamine, feel good; norepinephrine, fight or flight; GABA, chill out; serotonin means sleep; glutamate, excites; opioid neuropeptides is pain. And then we have neurobiology here, which is the brain part. Frontal lobe, don't forget. If something goes wrong with it, personality changes is what we're going to see. Parietal lobe is the parent. They will give you to, they will send you to school to read and write. Parietal means parent. Cerebellum are two different things. It's just nice to know this one. And then we have domain 1B, psychopharmacology. We just completed that now. You do have that content right here. Can you see that? So it's the same content I will cover in class, the key concepts that will be tested on the exam. Okay. Psychiatric assessment, clinical simulation. That's psych assessment. Clinical simulation is nice if you want to learn more, get deeper. It's just going to teach us on how to fill in the gap, especially if we didn't get a good clinical rotation. That is the beauty of my clinical simulation. We try to sim it the best way we can. Then we have the CM5TR here, which is diagnosis. If you're struggling with it, it's easy, right? All you have to do is just get it presented to you in class, then you've been exposed to it. Then you reinforce and reinforce and reinforce and reinforce. Okay, examples of common DSM-5-TR codes: autism spectrum disorder, attention deficit hyperactivity disorder, major depressive disorder, generalized anxiety disorder. It kind of give you the DSM codes, then kind of summarize it on the side. So it's telling you how to keep a questioning mindset. These are criteria that must be met. Very, very extensively long. You don't need all those criteria, just need enough to pass. Psychotherapies and theories is right here. That's my book, pretty much. Ensure that you come here and read this book. If you don't feel like reading it, you're going to go all the way to the back. Okay, all the way to the back. You're going to find the multiple choice question and enjoy your therapy. But content is key. Content is key. All right. Do we have any questions at this point? Now, if you need to go in through your phone, you come in here, log on to computer first. Come in here, click on that, and then click on QR for mobile login, and then click on proceed, and it's going to change you what you're going to ask for. Then you're going to go ahead and accept the invite. Okay, so that is pretty much it. Thank you so much for logging in. I'll see you again in the next class. Dr. Kende Elisha speaking, founder of MP Certification Academy. To reach us, nurse-to-nurse-coach@gmail.com or visit www.npcertificationacademy.com. Thank you so much and have a wonderful evening.